Ironside Pilates podcast series, episode 3, the Pilates breathing patterns and their benefits. Breathing correctly is crucial when exercising. Every kind of exercise has a breathing technique that works for it. The significance of proper breathing is emphasized for a number of reasons. Breathing practice is, as one example, an integral part of restoring spinal stability. Pilates exercises also stress how crucial proper breathing is to the stability of the midsection of the body, stabilizing muscles including the band of the abs that has the function of pulling the abdominal region in from side to side. Deeper abdominal oblique and multifidus help with voluntary breathing in addition to stabilizing the midsection. When exhaling, the diaphragm and the band of the abs that has the function of pulling the abdominal region in from side to side are active in particular, and at maximal exhalation they could flex to their maximum. By the greater abdominal pressure through flexing, the band of the abs that has the function of pulling the abdominal region in from side to side and diaphragm movement can cause the stabilizing muscles of the body's midsection to contract isometrically and the pelvic floor muscles to contract. Consequently, using abdominal breathing when performing stability exercises for the midsection can result in improvement overall. Breathing should always be taken into account during stabilization exercises because it controls the actions of the core stabilizer muscles. The findings of studies demonstrate that the band of the abs that has the function of pulling the abdominal region in from side to side and deeper abdominal oblique and deeper muscles along the spine were considerably activated when Pilates breathing was used during roll-ups, chest and head raises, and lifting exercises. The results of these studies are consistent with the findings made through other studies overall. For instance, that the incorporation of Pilates breathing greatly increases the activity of the band of the abs that has the function of pulling the abdominal region in from side to side, or deeper abdominal oblique. Researchers Yoon and others have also shown that the band of the abs that has the function of pulling the abdominal region in from side to side and deeper abdominal oblique are specifically activated by slow exhalations during roll-ups. The fact that breathing practice was given an intervention time sets this study apart from others. This study also examined the activity of all the midsection's flexion, extension, and stabilizer muscles, whereas earlier research was restricted to roll-ups and midsection flexions. Additionally, the impact of Pilates breathing on the core muscles during lifting exercises was examined. On numerous occasions, research has indicated a connection between back pain and lifting activities. Back pain during lifting activities can be decreased by contracting the midsection muscles by self-engagement of them. Pilates breathing increases muscle activity of the body's midsection, suggesting that practicing Pilates breathing techniques while lifting can lower the risk of back injury. Acute back pain makes it difficult for people to move due to extreme discomfort and potential adverse consequences. People's midsection motions are also limited right after surgery, for example. Even in the absence of physical bodily motions, Pilates breathing can activate muscles. Future research is therefore recommended to determine the ability to reach the wanted results of Pilates breathing exercises in individuals with acute back pain or in those whose midsection movements are limited as a result of recent back surgery. The results of this study demonstrate that the breathing practice intervention had immediate effects. To ascertain the long-term effects of the Pilates breathing practice, a follow-up research with participants for a predetermined amount of time is required. The findings in this study demonstrate that Pilates breathing enhances the activity of the band of the abs that has the function of pulling the abdominal region in from side to side and deeper abdominal oblique, as well as deeper muscles along the spine. As a result, when doing stabilizing movements of the body's midsection, the use of Pilates breathing can more successfully stimulate muscular activity. Additionally, by boosting muscle activity during lifting duties, Pilates breathing might help prevent future injuries. People with severe back pain or those who have had back surgery and have limited midsection movement may find that Pilates breathing helps them as well. To control deeper abdominal pressure, the diaphragm works in tandem with other muscles close to the abdominal muscle group. Low back pain is significantly impacted by these postural control functions of the chest region and abdomen through diaphragmatic breathing, which work in tandem with other active movement systems to preserve and improve spinal and mobility and stability of the core. The most fundamental techniques in stabilization programs are the contraction of the band of the abs that has the function of pulling the abdominal region in from side to side and pelvic floor through abdominal drawing and pelvic control of neutral position. In addition to changes in midsection structure and function, recent research has started to look into how actively employing different breathing exercises based on the active structure of the midsection can improve heart and lung function. The band of the abs that has the function of pulling the abdominal region in from side to side exhibited the largest activation changes among the abdominal muscles during maximal force expiration, and the activation change seemed to be larger than that of the abdominal drawing strategy. These benefits made it more feasible to use an expiration method to train the band of the abs that has the function of pulling the abdominal region in from side to side and pelvic floor in people who have low back instability, for example. The 27 participants in the current study were divided into two groups at random. No significant differences between the groups were found in the similarity test. The two groups showed significant differences in the low back extension angle and mid-back flexion angle in a standing posture. There were no discernible variations in the low back or mid-back regions when the alterations between the groups were compared. When standing with external load, the two groups showed significant differences in the mid-back extension and the low back flexion. Significant differences were also found in the low back area but not in the mid-back area when comparing the changes between groups. There was no significant change in the mid-back and low back flexion mobility within one of the groups, although they did rise and decrease respectively. The low back flexion mobility decrease was not significant, whereas the mid-back flexion mobility gain was significantly different across the groups. Breathing exercises are thought to have a significant impact on the spine posture, mobility, and stabilization of individuals with low back instability who have changed breathing patterns, according to the results of this study. Given how breathing affects both physical and mental health, more clinical research on breathing in people with different chronic musculoskeletal conditions is necessary. The Pilates method is commonly used by physiotherapists for various reasons, such as injury recovery, fall prevention, muscle imbalances, posture correction, general strengthening, and much more. One benefit of Pilates that's often overlooked is the improvement in lung function. One of the fundamental ideas of the Pilates method is breathing, often referred to as one of the cornerstones. The following are some advantages of using these controlled breathing techniques: less tension, decreased blood pressure, increased concentration, activation of the targeted or particular muscles, enhanced breathing and circulation, increasing lung volumes and respiratory muscle strength, reducing the chance of heart disease. To fully appreciate the advantages of the breathing pattern in Pilates, it's critical to comprehend the basic biomechanics of breathing. There are two stages to breathing. Breathing in, contraction of the intercostal and diaphragm muscles to expand the mid-back area's volume. The intra-lung pressure falls below the pressure in the atmosphere as a result of this volumetric increase. As a result, until the intra-lung pressure exceeds the pressure in the atmosphere, air enters the lungs. Breathing out, when the respiratory muscles relax and the lung tissue passively pushes back, the volume decreases, which causes air to exit the lungs because the intra-lung pressure rises as a result. Although exhalation is primarily a passive breathing phase, it can be forced by contracting and activating the muscles like the abdominal muscles, which push the diaphragm upward and lower the volume. The need for good breathing rises during intense exertion, and other surrounding muscles are frequently used. During exercise, Pilates emphasizes three main techniques: active breathing, set breathing patterns, and lateral breathing. The term lateral breathing describes the rib cage's lateral expansion during breathing while the deep abdominal muscles continue to contract, pulling downward. In contrast to diaphragmatic breathing, this technique tries to keep the abdomen contracted during motions and activities to safeguard the spine. Every exercise or movement is synchronized with a specific breathing patterns. A certain movement or exercise involves inhaling during one phase and exhaling during another. Percussive breathing is another name for active breathing. The goal of active breathing is to deliberately contract the respiratory muscles so that the lungs can expand and carry oxygen. This breathing technique aids in the activation or contraction of specific targeted muscles. The nose is used for inhalation, and the mouth is used for exhalation. The exercise 100, which involves doing 5 arm pumps during exhale and 5 during inhalation, is a good illustration of an exercise using active breathing. The following are some ways in which Pilates can enhance lung function. It fortifies the muscles involved in breathing. According to published research, Pilates can considerably raise maximal exhaling and inhaling pressures. When combining postures and movements with deep, slow breathing, the respiratory muscles must be contracted as rest of the body's muscles move. Strengthening of the respiratory muscles follows from this. It enhances lung metrics. After Pilates training, people's forced vital capacity, peak exhaling flow, and maximal voluntary breathing all improved according to studies. When coordinated breathing is used, the respiratory rehabilitative technique linked to Pilates results in improved breathing and flow of blood or fluid to tissues and organs. It enhances cardiorespiratory parameters. After Pilates training, people showed improvements in their peak at the maximum amount of oxygen their body could utilize during intense exercise. Also in the amount of carbon dioxide the body produces compared to the amount of oxygen it consumes. The standard proportion of the quantity of organic nutrients with total oxidation to carbon dioxide and oxygen, and to how much oxygen used by bodily tissue, the proportion of the quantity of organic nutrients with total oxidation to carbon dioxide and oxygen, and to how much oxygen used by bodily tissue during maximum exercise and maximum breathing effort. In other words, Pilates makes cardiovascular alterations, helps improve blood circulation and transportation through veins and arteries to and from the muscles, since it raises the maximum amount of oxygen the body can utilize during intense exercise. It increases the stability and movement of the body's midsection, since all of these segments are interconnected. A stronger core will result in better diaphragm function and breathing efficiency. This is one of the core concepts of Pilates. Breath control is emphasized as a key element of Pilates, which makes it distinct. Every exercise is made to be done with a certain breathing pattern that improves circulation, oxygenates the blood, and encourages relaxation. Numerous respiratory advantages may result from this emphasis on controlled breathing. Pilates can assist improve lung capacity when practiced regularly. Pilates training uses deep diaphragmatic breathing methods that promote full oxygen exchange, increasing lung efficiency, improve diaphragm function. The diaphragm and intercostal muscles, which are muscles essential for breathing, are strengthened by Pilates workouts. Both at rest and during exercise, this can result in more effective and efficient breathing. For the best respiratory function, one must have a good posture. Pilates helps to open up the chest and correct the spine, which facilitates better breathing and lung expansion. Decreased stress. Stress has a major effect on respiratory patterns, frequently leading to quick or shallow breathing, which is sometimes incorrectly referred to as breathing with the chest. Pilates uses relaxation and concentration practices that can lower stress and encourage deeper, more regular breathing. Thank you for listening to episode 3 of the Ironside Pilates podcast series, From a Pilates Perspective, What is Well-Being, Exercising and Fitness? Don't forget to subscribe to our YouTube channel and like us on Facebook.